Running a radio station seems low on the list of priorities in earthquake-ravaged Haiti, where thousands are homeless and hungry. But in a country where many news outlets have been destroyed, these radio broadcasts provide a vital source of information.
We are supplying information because information saves lives.
Welcome to the world of Internews, an international media organization that sets up operations in crisis zones to coordinate humanitarian relief efforts and empower local media. The day after the earthquake, Internews quickly erected a newsroom and production facility in Port-au-Prince. Their office also doubles as living quarters.
So what you see here, we have good mattresses. We are only 2 people in this room, 2 people in the other one. We have proper toilet. It's not so bad.
Their schedule is intense. They produce a daily radio show featuring news you can use. This is especially helpful for people living in tent cities who need to know about imposed curfews, waste management, water distribution points, and public health advisories. The staff at Internews puts the show together with the help of local reporters.
We are providing them the capacity anyway to keep communicating with people.
One of their reporters is Johnny Cesar. Cesar was a journalist for Les Nouvelles before the quake damaged the paper's office. But gathering information in a crisis is not as simple as picking up the phone. Cesar must rely on traditional shoe leather reporting. Today, he's on the medical beat.
We're going in 2 places. We're going, first of all, to Bicentennial Road, the big boulevard, where there's a place that usually people who have AIDS can find their pills.
His first stop of the day is to an HIV clinic. After the earthquake, people with HIV dispersed all over the country. Cesar's goal is to talk to doctors and nurses that can give him information about where these people can get medicine.
Those who have AIDS and tuberculosis, they cannot stop the treatment. So they say that they function still after the earthquake, and now they are taking care of the patients, and also they're taking care of those who have been in other centers.
Finishing up at the clinic, he sets off for the Red Cross, where he sees earthquake victims. One is this little boy.
Why he's not in surgery, I don't know. He needs to get to a hospital. He lost part of his index finger, and his thumb was severed, almost severed completely through. So we saw him 2 days ago.
The boy could lose his whole hand. Blood shortages are making it hard for the injured to receive operations. This problem has caused many preventable deaths and limb loss. Cesar is here to find out where people can donate blood. Wrapping up his reporting for the day, he heads back to the radio station to write a script and record the show. Yves Colon, a Haitian-born reporter who helps run the Internews project in Haiti, gives Cesar some tips. He says training Haitian reporters can be difficult.
Finding people to work, the kind of style that we want, punchy, to be able to communicate with people directly instead of communicating with government.
Colon, who has worked at the Miami Herald, says there are other difficulties as well, but he says it's worth it.
The great challenge is time. One of the biggest challenges is time to be able to do this every day and, get it out there to the radio stations. They don't come here to pick it up. We have to go out and deliver it to them. So, it's really challenging, but it's really exhilarating work.
As for Cesar, producing these broadcasts reminds him of why he became a journalist. He says it's the clearest way of him helping his people in one of the worst disasters in their history. In Port-au-Prince, Haiti, I'm Natasha Del Toro for Time.com.